Assalamu alaikum guys, welcome back to Oxford Pharmacist, my YouTube channel. Today we will be discussing about the epilepsy, how to deal with the epilepsy in the emergency condition, and what are the first aid measures to deal with the epilepsy seizures or first aid for seizures in general. So let's start this lecture without any delay, but first I will tell you what is epilepsy. So epilepsy is a brain disease where nerve cells don't signal properly, which causes seizures. Seizures can be uncontrolled, a burst of electrical activities that changes the sensation, behavior, awareness, and muscle movement, and that brings a condition that are called as seizures. And although epilepsy can't be cured, many treatment options are available, and up to 70% people with epilepsy can manage their disease with medication, any epileptic medications. So, epilepsy is a long-term chronic disease that causes repeated seizures due to abnormal electrical signals that damage the brain cells. And the seizures can include changing in awareness, muscle control, like your muscles may start getting twitching or jerk, and jerks sensation and emotions and behavior start changing. And epilepsy is also called as a seizure disorder. So these were the general introduction of the seizures. So let's see, who does epilepsy affect? Any of the age, any person with any sex, any race, any age, and any gender can be affected by the epilepsy. And like about 3.4 million people of the US are affected by the epilepsy. And worldwide is a very fastly diagnosed disease. So it affects your body in central part of the brain where the it causes a continuous electrical impulse, and this disrupt rhythmic electrical impulse pattern, damages your brain. And with the seizures you start losing consciousness, sensations, and emotions. So there are different type of the seizures that can be focal onset, and that can be focal onset impaired awareness, and it can cause generalized onset awareness that leads to the absence of the seizures, and autonomic seizures, and the tonic seizures, and the clonic seizures, and the tonic-clonic seizures. These are the different types of the seizures, including myoclonic seizures. So any like stress, sleep issues, and you are not getting enough sleep, and you are either consuming alcohol or any recreational drug, or either you are ill or you are having fever. So these all are the factors that can trigger the symptoms of the seizures. And even the flash of the light can also cause this. So if you are not eating healthy food, vitamin and any minerals deficiencies, and skipping the meals, and either you are doing physically overexertion, and there are some specific food consuming a lot of caffeine can also trigger the signs and symptoms of epilepsy or either seizures. Even dehydration and uh, certain time of the day and night can also cause the condition of seizures. And as I've told before, certain kind of the medications, like diphenhydramine, that is used in the condition of cold, allergy, and the sleep inducer. And diphenhydramine is also reported to cause seizures. And even if you missed the anti-seizure drug that your doctor have recommended you for either you for your epilepsy or your seizures, that can also induce seizures. For example, you are diagnosed with the condition of the convulsion or a convulsion disease, or either you are diagnosed with the condition of epilepsy, and you are not taking your medication, and either you are missing your medication, it can also induce the epileptic condition and epileptic seizures. So, in the condition of the epilepsy, the patient temporarily lose awareness, and the muscles start twitching very jerkily, and the patient who is suffering starting staring into the space, and he has lost confusion, and he got problem in the talking and understandings. His hearing, vision, taste, smells, and the numbness feelings start decreasing, and he feels a wave of heat in his body, and his limbs start smacking, and it can be a chewing motion and the rubbing hands and the finger motion, and the psychiatric symptoms include fear, dread, anxiety, etc. And there can be a change in the pattern of breathing during the epileptic attack. So these were the major, very common signs and symptoms that can lead to the a lot of injuries, head injuries, immune disorder injuries, and metabolic injuries. These can also all this condition that can cause seizures. But the main purpose of this lecture is to tell you how to deal with the epileptic condition. So I just briefly introduced you, okay, what is epilepsy, and what are the symptoms, and what are the causes, and what are the types of the seizures. Seizures, how, what are the factors that trigger the seizures. So now I will be telling you seizures first aid techniques. So first I will tell you a very brief way that is uploaded on the Children Health, that is a very reputed website to deal epileptic condition in children. So what if a child is having a epileptic attack, or a child is having a convulsive or seizures attack? So first of all, do not panic, because there is no certain medication or no quick remedy to treat the epileptic or the convulsion attack within a second. So do not panic. Okay. Then turn on their side, mean if they are on their full body positions, turn on their body to one side as mentioned in the figure, and start timing these seizures. Mean either you can get a clock to measure the onset and the end point of the seizures, duration of the seizure. Third, stay with your child. Do not make them feel alone, because in the during the attack they can harm themselves. And place something soft under their head to avoid any injury during the seizures. And do not put anything in their mouth. There are certain myths to put some things in their mouth to avoid the attack. Do not put anything in their mouth. And call emergency number if the epileptic condition or the convulsions last longer more than 5 minutes, then obviously do call your emergency number that is available, or ambulance, call the ambulance. And then आ जाता है seizures first aid, that is mentioned in the epileptic website that is very reputed, the epilepsy on the website of the Epilepsy Foundation. So I found this banners very attractive and very informative, so I think I should share this to you. That is being published by the Epilepsy Foundation. So first aid seizures, what are the purpose? Stay one, stay with the person and start timing the seizures. Remain calm and check for medical ID. Stay calm and check for the medical attack time and medical ID. And second, keep the person safe. Move or guide away from the harmful object. Any prickly or any sharp objects, keep that object away from the seizures person who is suffering. Third, turn the person onto their side. If they are not awake and aware, do not block their airway. So the purpose of turning their side is to make their respiratory system work properly. Do not block airway. Put something small and soft under their head, and loosen or tighten their cloth around the neck. Fourth, do not put anything in their mouth. Don't give them water, don't give them any pills, don't give anything in their food until they are awake, because that can lead to choking state, or and their respiratory system can choke. Or even if you give them anything liquid, it can cause aspiration, and it can lead to pneumonia or the respiratory infection. Fifth, do not restrain. Six, stay with them until they are awake and alert. The seizures, don't leave them alone. And most of the seizures ends within a few minutes. If they last for more than 5 minutes, call the emergency number. If the seizures last longer than the 5 minutes, call the emergency number. If they are suffering from the repeated seizures, call for the emergency number. Difficulty in the breathing, called for the emergency number immediately. If seizures occurs in the water and they were in the water, then call the emergency number immediately. Person is injured, and if the person is pregnant or sick due to that seizures condition, then call for the emergency number. Person does not return to its usual state. He is still in the unconscious state of the attack, and if it's the first time of the seizures, immediately call the emergency number and visit your emergency in the nearby hospital. So, third poster I like that is here. The first aid for the seizures in the complex, psychomotoric, and the temporal. Recognize the common signs and like blank staring. These are the different types of the seizures condition. So either the person is blank staring at something. There is no visual signs of the twitching and the convulsion, but they are blankly staring at something. This is a sign of seizures. Then comes the chewing. They are chewing something, and they are fumbling, and they are wandering, and they are shaking without any reason, and they are doing a confused speech. This can also a type of the seizures. These are the common signs and symptoms of the seizures. And follow for the seizures after the seizure attack. You have to time the seizure, measure the duration of the seizures, and speak calmly to them. Are you okay? Are you now feeling well? Either you have asked them about what are they feeling now after the attack, and do not grab or hold them. Just turn their side and do not hold them or grab them. Keep their body free and explain it to others that what happened to them, and hold any block any hazard that can damage the person. For example, any traffic or any conditions that can be hazards for the patient in unconscious state, block that thing. So these are also very things that you should know about the first aid of the seizures. And if the first aid is like conversion in the generalized tonic-chlorine and the grand mal, do not put anything in the mouth. Lock for any medical alert and identification. There are certain kind of the bracelet and certain kind of the signs that shows what kind of medication is recommended for the patient in that condition. So these are also time the seizures in a watch. Don't hold down as seizures and offer help. Do you need any help? We should call any emergency number. Do you have any home address? Do you have any friend who is nearby who can attend you now? And cushion their head and the glasses, and and always lie them in a side like this, and loosen or tighten cloth in so they can breathe properly, and turn them on their side. So these were the some things that you should know about the. So stay with the person and start the time of the seizures. So now we tell you how you have to start the time of the seizures. It will help other to stay calm, talk calmly, and reassure to the person during the time after the seizures. It will help as they stay from the seizures, and check for the medical ID if they do have any medical ID card that is mentioning their certain condition. Look at the watch and time the seizures from beginning to the end of the active seizures. Timing the seizure will help you determine if the emergency help is needed or not. While most of the seizures only last for like few minutes, if they last longer than the 5 minutes and they lose their consciousness and they get any injury, then call the emergency number. Then comes the keep the person safe. Move any harmful or sharp object from their side, and if the person is wandering confused and he's staring something in a dangerous situation, move that person away from that place. Like gently guide them to away from the traffic and the train or the subway, and any height they can fall, and any sharp object. Encourage the people to step back and give the person some room so they can breathe properly. Waking up to a crowd can be embarrassing and confusing for a person with seizures. Ask someone to stay nearby in the case if they need any help. Then come turn the person on their side. They are not awake and aware. So you have to turn their side, make the person as comfortable as possible. Tighten their cloth. If they are not aware, sit down and make them lie on a safe place. If the person is suffering from the tonic-closing seizures, lay them down on the floor. Put something small and soft under the head. Turn them up and toward the ground. So prevent the blocking of their airway. During the convulsion, if the man is looking like stop breathing, then when the chest muscles tighten during the tonic phase of the seizures, as a part of the seizure, the try to relax the muscles and breathing to make the breathing resume. And in that condition, you have to call the emergency. You can't provide first aid for the muscle tightening of the chest, and if the person is stop breathing, so rescue breathing, like you can do CPR in that condition. And then comes the do not put any object in their mouth, any tablet, any food item, any herbal or tonic traditional medication, nothing, or any allopathic medication, or any juice, water. Do not put anything in their mouth. Even a spoon, even a sharp object, they can hurt their mouth with them. Because they are in the unconscious state, they can't swallow it, they can't chew it, they can't properly indigest it. So there are certain kind of the rescue medication, mostly are the IV injections. So I will tell you briefly what kind of the medication that are recommended in the condition of the uh, in the case of the epileptic attack. The medication include that can be recommended. It can be sodium valproate, it can be carbamazepine, and it can be levetiracetam, and it can be lamotrigine. So these depend on the patient condition. It can be like any relaxant like cannabidiol. It can be cobazamam. It can be clonazepam. It can be diazepams. It can be acetazolamide, and it can be like diazepam. What will the route? So diastat, that is diazepam rectal gel, it is all recommended, but this is mostly not very comfortable to use rectal gel. Then the midazolam nasal spray, you can spray in the patient nostrils. And then comes the diazepam nasal spray. So these are the medications that can be used in the patient with the epileptic attack, under the epileptic attack. And then comes the do not restrain. Try to stop movement or forcefully hold the person. Do not, like, if they are under jerking attack, like, don't stop them from jerking. Don't hold them. If a person try to walk around, let them walk. It is a safe. And do not restraining a person can lead to injuries. And the person is confused, agitated, and aggressive. People don't fight on a purpose during the seizures. Yet, if they are restrained when they are confused, they can make a more aggressive response. So, do not restrain them and do not hold them. Let them in the condition. You can provide them medication, you cannot provide them any for certain treatment. So, stay with them until they are awake, and do not leave them alone, because they are in a very sensitive condition, and the seizures might long for some few minutes, and they can have breathing difficulties and other airway passage difficulties. So you have to call the emergency number immediately. And do not make if they are like awake after the attack, they might feel embarrassed when they get awake and they are lying down and a lot of people watching them. This is quite embarrassing condition for them. So do not make them feel alone. If you know them and they're under attack, stay with them and do not leave them alone in awkward situation of the attack, because they are very sensitive, and they need support. They need your support because you know them. And once they are able to communicate, uh, make them normalize the things and reassure that they are safe. And until they are normal to this activity, stay with them. And when to call the emergency? If the seizure is like for the 5 minutes, repeated seizures, difficulty in the breathing, seizures in the water, the person injured, pregnant, and sick. I have told you already this before. These are the real quick view and the first time for the seizures. And person asks for the medical help, call the emergency number. So why you need what are as needed or rescue the medications. I have told you alprazolam, diazepam, nasal sprays are the most commonly used now. There are certain IV drugs that can be administered, but the IV administration is very difficult because the person is like jerking and jerking. It is very difficult to insert an IV line to them. So nasal sprays are the most commonly used. In the diazepams are the most formulations that are used to rescue their. So might be they have that spray in their backpack or their ID card. They're mentioned that this kind of certain medication. You can visit nearby pharmacy or any hospital to mention that we need diazepam spray if they're available in their backpack. Check them. And what other medicine can be used to rescue the treatment? There are certain anticonvulsant drugs, and there are certain kind of the muscle relaxant medication that can be used to treat that epilepsy condition. But that would be done by a well-known person, that how to administer a nasal spray, how to administer rectal suppositories of the diazepam, and how many sprays you have to do in the patient nostril in the condition of the epileptic attack, to avoid or to treat the condition of that epileptic attack. So there are certain person who is known to add to certain setup, so that person should be the person responsible for the medication and the rescue treatment for them. So mostly should be a person who is medically known and who is a medical healthcare provider. So that's the better if the medication provider is a healthcare provider. So that was all for the epilepsy and the treatment of the epilepsy and the first aid plans for the epilepsy. How you have to manage any patient who is suffering from epilepsy. What happens if a person is suffering in front of you in the condition of epileptic attack or the convulsion attack. So I hope this video would be quite informative for you. If you like this video, kindly subscribe to my channel, Ask Your Pharmacist Mariam, and do share this video as much as you can to your community circle. Thank you so much. Do subscribe, share, and like this video. And if you have any query, you can ask in the comment section. I will love to answer your queries in the comment section. Thank you so much. Allah Hafiz.